Hi, Janice. I'm here with Janice. My name is Debra Battistella. I am the host of the OT Meeting Room, and I'm here with Janice Giagnacova today, and we're going to talk about trauma. Janice and I have worked together in subacute rehab before, and our paths crossed after that again another time, and we teach together in an occupational therapy assistant program here in Western New York. So Janice, why don't you tell us a little bit about your history, your occupational therapy self, and your involvement in trauma?
Okay, well, I've been an OT for 40 years, so a long time.
Yeah.
Yeah. Um, I've worked in multiple settings. I've worked in school system with children. I've worked in subacute rehab, rehab hospital, acute care, home health, outpatient rehab. Um, I was a manager of a big rehab department for many years, supervising aquatic therapy and cardiac rehab and outpatient, inpatient, developing an arthritis center, developing a workplace ergonomic program and an incontinence program. So I really had varied experience,
Yes.
also in long-term care. And now I'm teaching with Deb. I stopped practicing as an OT in the end of 2018, and now I'm teaching. I have my bachelor's in OT. I got my degree back before master's was required,
Okay.
and I have my master's in mental health counseling. I went back to school and worked as a child and adolescent counselor for 2 years, and that's when I got trauma certified so that I could better serve my
Okay. Yes,
clients.
I remember. I didn't always know that you were trauma certified. And over the past, I don't know, year or so, I would say I know we've had more conversations about trauma and the effects of trauma on people. The fact that it's just there's more awareness around trauma now with trauma informed care, and um, I just think that it's more information about trauma is known, and we're becoming more and more aware that a large majority of people in the world, just by nature of living, have experienced some sort of trauma, and that the body can identify events as trauma even if you don't assign something as being a traumatic event. And it's fascinating, I think. So I'm really excited that we're going to have this conversation today. And the reason I wanted to talk with you about this and have us share some conversation about trauma is because of the situation with COVID right now. Now, I told you when we were setting this up that I had been working in the hospital. So my employment history recent is working as an acute care therapist in an early mobility program in the critical care units. And there were two recent events that I shared with you. So one was where I was speaking with a nurse about a patient who was on the younger side of the age spectrum, who had a brain injury type of event, and the person subsequently fell while they were out of bed in the chair in the care of the nurse, the therapy practitioners. That happened, and it was a traumatizing event for everybody involved. And shortly after that was when COVID suddenly appeared. And the entire hospital changed. They had built walls where there were no walls. They had made these lockdown units, sort of, where if you went in there, you had to be in full PPE. Once you were in, you couldn't come out. And while I was in there, I had a full-blown anxiety attack. But the reason I realized that I must have experienced some trauma as a result of being in that situation was when I was talking to the students about what it was like, and I just started crying. And I've noticed that these types of experiences are happening to different people. So people are finding themselves stressed out and emotionally affected by these experiences. People who work in skilled nursing facilities, long-term care facilities are commenting about how they don't feel okay. It's taking a toll on them emotionally because either there are a large number of deaths or people are kept in their rooms. They're not allowed to gather together. People have to put on all of this equipment just in order to interact with people, and it's very challenging on people. And so I want to talk a little bit about what trauma is, pick your brain about like the inner workings of trauma or anything that you would like to share from your knowledge, your experience, that a conversation around this might be helpful to people listening to us.
I mean, trauma is just considered a severely distressing or disturbing event.
Okay.
Trauma can be something different to anybody, it's very individual. Something that traumatizes one person might not necessarily be as traumatic to another person.
Yes.
One thing that you said about you started crying makes me think of one of the most important things about trauma is being self-aware of being aware of what's traumatized you.
Mm-hmm.
You can go the next step of trying to do something to cope with it. If you're not aware that you're having symptoms of trauma, then you may not develop the coping mechanisms or do the things that you need to help yourself.
It's very interesting.
Yeah, self-awareness, I would say, is the first weapon against trauma, fighting trauma or vicarious trauma. Where you're repeatedly witnessing other people who are traumatized or dealing with other people who are traumatized, which is what we do in healthcare.
Yes.
And you don't realize why you're being irritable with your family or why you're isolating or why you can't concentrate or why you can't sleep. You're not tuning in that it's because of your work environment that you're experiencing all those symptoms. I think we've been traumatized as healthcare workers for years. It's kind of part of the job. Mm-hmm. But the COVID has added an extra layer to that, an extra dimension and intensity to it because there's so many people who are severely ill and who are dying. So the health exposure with healthcare workers has increased. And people are working longer shifts and more demands. And I mean, in the past, anytime I had to wear PPE and work with a patient, it was stressful because you're dealing with somebody who's in a very difficult situation. So empathizing with the patient, which can lead to vicarious trauma if you over empathize. I mean, as OTs, we need to empathize in order to have an effective therapeutic relationship, but you have to create boundaries and not over empathize.
Yes.
Taking their trauma on.
Yes. I think that would be something that would be worth talking about a little bit, about creating boundaries, because something that I think you and I get to hear a lot about in terms of the empathy piece and concern for the patient. We hear more about that, I think, because of our teaching in the OTA department. And it's something that we talk a lot about. And it can be easy to cross a line and get caught up in the patient's scenario, but also in this time of the COVID stuff where you go in this patient's room, and I had so I'll tell them about my experience. So I had full gear on. I had 2 masks, I had a face shield and the hat. And a lot of what we do in the intensive care units, very hands-on care. So it's nice the patients are getting that contact. They're getting human contact and they're getting that interpersonal interaction. But when you've got somebody who's on a ventilator, they don't feel well, and now they can't really see your face. I mean, all they really see are your eyes. And that bothers me because I just put myself in the other person's shoes, and how would that feel? You know, their family members aren't in the room, and so we're the only ones in there, and all of the doors to each room were closed during that time. And so there's another level of separation between the patient and human interaction, and all the nurses, they're busy, you know. So how do we set those boundaries where we don't constantly cross over into over empathizing? Do you have any helpful hints?
Well, when you were saying about the face mask,
Whoops, a little bit of freezing right there. And that happens sometimes with this COVID situation and a lot of distance learning where internet frees up a little bit. Whoops, Janice, you froze for a little bit.
Oh no.
I know you probably said something really good too.
Oh, do you have me back?
I do. I have you back.
What was I saying? Oh, I wanted to make a comment. You said about the face mask.
Yes.
Yeah, facial expression is such a huge element of communication and developing relationship with the patient. And so you're starting at a deficit right off the bat.
Yeah.
But as far as empathy, there's empathy and then there's mindful empathy. And mindful empathy is when you can try to understand the patient from their perspective, understand their worldview, but not over empathize where you're feeling what they're feeling.
Okay. Yes.
Absorbing what they're feeling and taking on their distress. So mindful empathy, deliberate. What is it like for them? Try to see from their worldview, but not take on all the feelings that they might be feeling, which, you know, then could lead to vicarious traumatization, especially if you're doing over and over and over and over.
That's a very good, helpful hint.
The way I explained it.
Yeah.
We have to have empathy or we can't have a therapeutic relationship. I mean, I teach therapeutic use of self, and that's a huge thing. Empathy, understanding from your point, from the patient's point of view, but setting that boundary of not taking on their feelings.
Mm-hmm. I like that one a lot. Now, you had mentioned an article that you found in OT practice,
Yes.
and you shared that article with me. And I think that I'm going to, I was going to share my screen, but I just want to state the article is called Compassion Fatigue. Let's just look at Compassion Fatigue, Self-Care Skills for Practitioners. It's by Donna M. Costa. And in that article, I read there's a pretty high percentage of healthcare workers who enter healthcare fields to help other people. And it can be considered because they have experienced trauma in their lives, so they want to help others. And I think that's an important topic to chat a bit about, because if people have been traumatized and they haven't really processed their trauma or dealt with their trauma, or they perhaps haven't taken the time to learn a little bit more about trauma, then there's like, you can be re-traumatizing yourself through whatever interactions you're having with the patients, but then maybe they cross that line a little too much and take on a role in that over empathizing with the patient, because it might be meeting a need within themselves. And I think that's something to be careful of, because I could see where people could become burned out from that.
Yeah, absolutely. I mean, that comes back to the self-awareness. You have to go into healthcare trying to develop your own self-awareness of your history, what your triggers are, what's going to impact you, why you might have an aversive reaction to a patient, probably related to something in your history.
Mm-hmm.
So the more self-aware you are, the better you can deal with situations at work. But absolutely, I mean, I have trauma in my past, and from loss,
Mm-hmm.
and I had multiple triggers working in a hospital. Being in an emergency room was a trigger for a long time. Hearing somebody on a ventilator was a trigger for a long time. So,
Yeah.
you have to be aware of those kinds of things. And
Mm-hmm.
it's going to help you to deal with your work situation if you realize what's going on with you and,
Yes.
in relation to your patients and how you're reacting to events and people at work.
Mm-hmm. I think in terms of self-awareness, I think as OT practitioners, we are a little bit lucky in that area because reflective practice is taught. We're taught that in school, and we we had to do a lot of self-reflection as we were going through our OT programs, and so that's a skill. And I know that when we teach our students that, sometimes they get tired of that piece.
Yeah.
But I think that's a huge benefit to being an occupational therapy practitioner, is that high level of self-awareness that we promote and that we learn in school. And when you mentioned that, it made me realize I don't know that when people enter a program that that's something that's really part of a curriculum, is developing that self-awareness so that we can have these healthy boundaries and keep our health throughout our careers and not experience that burnout or that compassion fatigue.
Exactly. One of the most, I think one of the biggest revelations to me when I got trauma certified, which was like an extra 2 semesters of school.
Mm-hmm.
So it was quite an undertaking. But one of the things that was the biggest revelation to me is that people want to talk about their traumas.
Mm-hmm.
And those people tiptoe around the elephant in the room, or what if they know somebody's been through some trauma, they avoid it because they think it's going to trigger memories or make them think about it, when usually it's something pretty close to the surface of their conscious thought.
Mm-hmm.
And they need to talk about it. So like the first thing when in trauma counseling is I would have the client make a list of the worst things that ever happened to them.
Mm.
And they had to prioritize them by number. And then we'd start with the smallest one, the least traumatic event. But it was this feeling from them of, oh my God, somebody's finally asking what happened to me.
Yes.
Somebody's finally, thank God, somebody's finally asking me what happened. They want to talk about it, and you need to talk about
Mm-hmm.
with other people, especially
Yes.
in a support group situation where like with healthcare workers, if somebody experiences the same thing, because how many times when we go to work in a healthcare setting, we just do whatever we're required to do. That's our training. You
Oh,
put on PPE and go in, you put on PPE and go in,
yes.
Whatever you need to do, you just do it. But how often do you say to somebody, oh my God, that was scary. I was so afraid I was going to catch COVID, or I was so afraid I was going to catch TB, or we've always worked with people with contagious illnesses. Now it's more, but never really discussed with any.
Yeah.
I remember in my experience, what was traumatizing about it to us.
Mm-hmm.
So
Yeah. I didn't
talk about it.
I didn't even really learn about processing trauma until fairly recently. And it actually kind of came about in my life in a very roundabout way, where I wasn't feeling healthy, and traditional medicine wasn't helping me get better. So I started seeking some alternative methods. And I was going to different talks in the community to learn about different alternative methods. And I learned about EFT tapping. And the more I learned about it, the more I learned that that's kind of when I started to learn that the body can hold on to trauma and you can process it. And I remember a couple years ago when I first started working in the early mobility program. So it was probably more than a couple years ago, but I was walking in the unit and I was hearing the familiar sound of a vent dinging. And I was like all of a sudden it occurred to me, that's been dinging for quite a while. Maybe I should investigate, because when people cough, that vent can ding. And I think it's easy for people who work in the intensive care unit to start to tune out those
Like
sounds. Like what?
bed alarms. There's
Yes.
bed alarms, they just
Yes.
rolled or something, but
Yes. Yes. So I had been hearing it for a little bit and I thought, well, I think I'm going to investigate. So I started walking down the hall, looking in the different rooms. And all of a sudden I looked into a room and there's a patient with the oral tube that goes right down in through the mouth and the throat. That's in their hand.
Oh God.
And I'm pretty sure that's the look I had on my face. I just said, oh my God, this is where it's coming from. And I stepped out of the room and I started walking down the hall, and a nurse was coming right into the unit from outside the unit. And she saw the look on my face and she started running, and I just pointed to the room. I couldn't even talk. I just pointed to the room and they all went in there. But I had enough sense at that point because I had learned what I learned about tapping and trauma. So I found a bathroom. I just went into the bathroom and I thought, oh my God, this is potentially traumatizing. My heart was racing.
Yeah.
And so I did a little tapping to process all of that, because God knows there's enough stuff that you see in a day at work that you don't need to hold on to that and let it affect you physically. But
Yeah, I think the most traumatizing things for me at work over my career is if I perceive that I harmed somebody in some way. So that could be a situation like if you didn't grab a nurse, or you weren't able to act on that and something happened to the patient, that you could feel traumatized by it. Like
absolutely.
fell on me. Oh my God.
Oh.
Somebody fell on my watch. I was traumatized.
Mm-hmm.
Because I thought it's my fault. It was on my shift. I'm responsible for whatever happened.
Yes.
I remember I was doing subaquatic ultrasound on somebody.
Mm-hmm.
And I had the setting wrong, and I was worried I gave them a periosteal burn, and I was freaked out about that. I mean, I didn't have many incidents like that, but you can see the ones I had stuck with me all this time, because it's traumatic for me to think I inflicted harm on somebody.
Yes. Yes. I had a patient fall on my watch too, and it was the worst day in my life, in my career. And
we're here to help, not hurt, right?
I know. I was very fortunate because the patient was at the facility because they were falling all the time at home. The family members were very understanding. They did not blame me at all. The staff was understanding, but that's not always the case.
It doesn't even matter that much.
No.
I mean, I'm overly responsible, but I still
No, you internalize it. I think you internalize that. And yeah, I think too, there's this level of something where you think it's easy to fall into a thought pattern, maybe where that happens to other people. That will never happen to me until that thing happens to you. Life events do happen to us. But it's easy to get caught up in thinking that won't happen to me. And then, yeah.
Like, with COVID, you have to do everything that you can do to keep yourself safe, to keep your patients safe. But after that, everything is not in our control. And I think a lot of it is accepting what we can't control. And just
yes.
the best you can.
Yeah. Having a little trouble hearing you right now. Just,
oh, no.
No, that's better. There you are. That's good. Yeah. So having a level of self-awareness, and then I think that point that you just made about accepting that there are some things that occur outside of our control, doing all you can, like doing your best always in a situation and knowing that you're always doing your best, and then accepting that there are things that we don't control.
And I think you have to cut yourself slack that you're doing the best you can in that moment. Your best today might not be your best tomorrow.
Yeah, that's a good point too. Maybe speak to that a little bit.
Pardon?
Maybe you can speak to that a little bit. The fluctuations that can occur day to day.
Accept in ourselves that we're doing our best in that moment. You know, we might not be feeling well. We might have had something happen at home. It could be any number of factors, but to accept that, you know, your best today might not be the same as your best tomorrow.
Yes.
That everybody isn't at their best all the time.
Mm-hmm.
If that makes sense.
That makes a lot of sense. And I'm glad that you brought that point up, because I don't know that we think of that a lot.
You're doing the best that you can in that moment. I mean, I teach my students not to bring home to work. And when they're ready to enter a patient's room, to kind of let everything go and come from a place of compassion and love when they enter the room. But, you know, sometimes that's possible and sometimes it's not.
I know, especially
that's an ideal.
That is an ideal.
Home at home and leave everything at home and clear your head and be there for your present for your patient.
Yes.
So it's an ideal, but you know, it may not be possible every day.
Right.
There are things that happen at work, you know, that can be upsetting before you go on to your next patient.
Yes, absolutely there are. And I think personally, with age and the wisdom that comes with age and practice, I'm finding that it's easier to leave outside the door when I go into a patient's room. And the more I've practiced that, the better my patient interactions become. And yeah, I feel like I'm an effective therapist. I feel like I'm giving my patients what they need in the moment, and I just feel like it's something that's taken a lot of practice.
Yes. Dr. Fagley, Charles Fagley, one of the people that was quoted in the article on compassion fatigue,
Yes,
by Costa, he made a very interesting point about like self-care routines or things you should do if you feel that you are suffering from some type of secondary traumatic stress from work.
okay.
And what you were just saying about leaving home at home when you go to work, the reverse is also true. You need to leave work at home when you get home. And if you are having some type of secondary traumatic stress, that's often something you're not doing. And so,
Oh, interesting.
in order to help that situation, he suggested a transition ritual, which I thought was really interesting, that you come home and whatever your ritual is, it is. Maybe you spend, one woman said she spent 10 minutes outside bird watching at her bird feeder because that's what she liked to do. And when she got in the house, she knew she wouldn't be able to do it because her kids and whatever. Come home and change your clothes and make a ritual out of changing from your work clothes into your home clothes. And so it's like kind of symbolic of leaving work at work and now you're home and you're in this outfit or whatever it is. But it made a lot of sense to me that if you're having trouble separating work from home once you get home, to have some kind of ritual that helps, you know, symbolize that transition or, you know, solidify that transition and help you to leave work behind so you're not thinking about it all night.
Yes, I like that too. And I think, again, as occupational therapy practitioners, there's another bonus for us because we do learn about rituals and the roles that rituals play in people's lives. And we can apply that information to ourselves.
Good point.
And finding a meaningful ritual.
Mm-hmm.
I like that one.
Right. Like we teach kids to have rituals for transitions when they have difficulty transitioning from one activity to another. Whatever. And you're right. We can apply the same things to ourselves.
Yes.
Absolutely.
Yes. And how much more present will we be for our families when we do that and we don't bring the stresses of work home with us? because really, I mean, our families didn't go there to work. They shouldn't have to experience that either. And yeah, I noticed there was something else in the article that was interesting too. It's the difference between compassion fatigue and burnout and the causes of each, where compassion fatigue is caused by that over empathizing or constantly re-traumatizing yourself and those events related to the patients that you work with, where burnout tends to come when you don't feel supported in your job or if you don't have the tools to do your job. Am I understanding that correctly?
I think, yeah, compassion fatigue is like brought on by over empathizing and kind of doing your job well,
Mm-hmm.
caring about what you're doing.
Okay.
And burnout, I think you get to the point, yeah, you're not supported, you don't have the tools. Maybe you don't know one of the foundational things for employee satisfaction is understanding your expectations at work
Mm,
and then having the tools to do it. That's like the base of the pyramid as far as satisfaction at work.
okay.
And burnout, people are at the point where they really don't care anymore.
Yes.
Versus people with compassion fatigue, I think are still invested
Mm-hmm.
and
Okay.
here. And burnout is at a point where they're past caring about anything they do at work.
I feel like that's a little bit of a dangerous place to be in for you, your patients that you're working with, your colleagues, your
Yeah,
family.
not a good place to be.
No.
And but what I wanted to say about compassion fatigue, though, which is kind of what we were talking about, the vicarious trauma, is after self-awareness, people should really evaluate their self-care. This is
Mm.
huge. Evaluate your self-care. And I have my students do a self-care inventory. You can find them online.
Okay.
Just to evaluate your practices in all the different domains of wellness, like physical, cognitive, emotional, occupational, spiritual. And where are you lacking? You know, where are you not, where do you have a big imbalance?
Mm-hmm.
Or aren't you doing enough to take care of yourself? And, you know, if somebody finds themselves having some kind of secondary traumatic stress, or even if they want to prevent it, to analyze what they're doing in terms of self-care across all those domains and figure out what their weakest areas are and identify some new practice that maybe they can start to, you know, help themselves feel better, whether it's journaling or exercise or eating better or going to church again or meditating, whatever it is, joining a support group. I think social is another domain I didn't mention. Huge.
Yes, especially right now.
Especially now when everybody's kind of isolated.
Yes.
Like a work support group during COVID would be a great thing to be doing.
Mm-hmm. It would. And I think that something I would like to say about support groups, I learned from a book that I read that a highly respected occupational therapy practitioner in our local area suggested I read. Am I going to be able to think of the name of it? Yes, The Body Keeps the Score. It's a great book. I haven't finished it yet. I'm listening to it as an audio book. But an important point that the author made in there is if you're with a bunch of people who are traumatized, sometimes people, they'll invite you into the group and like you become like this like an honorary member or a group of people who now are more identifying with the trauma rather than healthfully processing the trauma. So there's like a fine line in support groups. And if I think about that in terms of work support groups, there has to be some kind of a guideline that you set up where you don't just start complaining about work, because
Absolutely.
I don't find work complaining helpful. Like once in a while you have to get something out if something happened that made you feel a certain way that's not good, or even if it's good, you should talk about it, but not to stay there in a complaining mode, but to talk about things that are going on. How does it make us feel? How do we help ourselves with this? Can we laugh? Like, is there a way to laugh?
It would be so easy to go off on a track of everybody just venting and adding fuel to the fire and really not resolving anything or leaving the group feeling any better. So I would say a social worker or somebody with training in group and have some guidance and some kind of format and goals for the group, not just a directionless, group of people meeting to complain about work. Absolutely.
Yes.
You're 100% right. Yes. Or it could be detrimental versus helpful.
Mm-hmm.
Yes, I totally agree. Have goals.
Yes.
Have somebody guide it.
Mm-hmm.
Training.
Yeah. I wonder if there are any places of employment doing that for their employees right now, offering extra supports. I know when I was furloughed, I was given a packet of papers, with the employee assistance program information and all that on there. And but what about the people who are still at work, working and constantly facing whatever stressors they're facing? I just wonder if there are places that offer groups.
I'm sure there are somewhere, but I doubt that it's prevalent or, common. I think it's probably unusual that you have a manager who's very in tune with their employees and caring about their employees and pursues those kind of things to ensure their employees' well-being. But I think that's probably not the norm.
Yeah, I think you're
probably not the norm. I mean, my last manager didn't even talk to the employees except at staff meetings. So,
that's not very nice.
there's good out there and there's not so good out there. And you
Mm-hmm.
a manager who's in tune and proactive and caring about their employees. And,
Yes.
and you need to find the time in a really busy workday to do something like that. And maybe some people will be willing to do it on unpaid time.
Mm-hmm. Maybe.
But,
yeah. I think yeah. It would be nice to hear of people starting something like that as a result of this conversation. Even that would be awesome. I mean, in this society that we live in, where we're so productivity driven,
yes,
more is always better thinking, it's not helpful to anybody, really. And employees suffer, the patients suffer, the facilities suffer. And so it would be nice to see a change in that.
I mean, having a group, which I find this really helpful with my students when they do the self-care analysis and then they identify a new activity in one of their, weaker domains that they're not really practicing self-care, and then they share it in class.
Mm-hmm.
And an employee group that shares coping skills with each other would be really helpful because you can always get ideas from somebody else that maybe you didn't think of yourself.
Yes.
And somebody else says, well, I journal and that really helps me cope. And, whatever, I call a friend or whatever they do.
Mm-hmm.
The students always benefit from hearing each other's ideas and saying, oh, maybe I'll try that. That sounds really great.
Yeah.
And sharing coping skills with employees working under stressful situations, that could be a positive, helpful.
Mm-hmm. Absolutely. I like that one a lot.
Mm-hmm.
Yeah. So we talked about self-awareness. We talked about coping skills, rituals. Is there anything else that you think would be valuable for people to hear about or learn about?
I mean, during this time, I would say really work at maintaining social support, especially if you're not living with children or a family. If you're alone, maintain social support to, feel that human connection is so important. If you're just going to work and being stressed out all day and then, being home alone and not having a connection or somebody to talk to,
Mm-hmm.
I think that could be detrimental. Usually social support is it's a basic need, and it's important for mental health.
Mm-hmm.
Social support is important for mental health.
I know it's not always easy for people who feel alone to reach out to other people. And I know I tend to be a little bit of a loner, although I don't usually feel lonely, but I have had times in my life where I have felt lonely and alone. And during those times, I've been able to force myself to do something, to reach out to somebody. And so even if it's to call a friend or to send a text message to somebody, just say, hey, thinking about you. You don't even have to say, I feel lonely, I feel alone, I need somebody right now. You could just reach out because you care about somebody else. And a lot of times that has helped me to remember to care about somebody else too, because I know that if I feel a certain way, there are other people who feel similarly, because we're humans and we share these common feelings. So do you have any helpful hints for people who might have a more difficult time reaching out? Do you have any suggestions? Oops, you froze again. I'm pretty sure Janice is saying something amazing right now. We just can't hear it. Oh, there you are. You froze again.
You froze too.
Oh.
You're both frozen.
Oh, well, we're both frozen. I just was saying that I'm sure you're saying something amazing right now and we're not hearing it.
I didn't hear your question.
Oh, okay. Okay, so my question was, do you have any suggestions for people who might feel it's a little challenging for them to reach out if they are needing a little social something, but they don't know how to do it?
I mean, I know what I do. If I feel like I should reach out or somebody might be in need, I just kind of, well, sometimes I have to force it.
Mm-hmm.
Sometimes you have to push yourself to do something that you might not really feel like doing at the moment, but you do it anyways. And I'd say that pretty much 100% of the time it was the right thing to do.
Yes.
And I'm glad I did it.
Mm-hmm.
But I'll just scroll through my contact list.
Oh, that's a great idea.
And pick somebody that I feel like needs me to call them, or I need to, or whatever, you know. And yeah, especially during this time when we're all kind of home.
Yes.
I've been doing that more and more. Yeah, I just talked to a friend of mine in Florida that I didn't talk to for a couple of months. I just talked to a friend in Buffalo who's having surgery next week. Yeah, so I'll just kind of scroll through my list and I'll say, oh, you know, I should really call this person, or I should call that person. And I, you know, might not always feel like, but it always works out.
Yeah, I love that idea of scrolling through the contact list, because sometimes when you're feeling low, you can't even think of who you would even want to talk to, you know. So I love that.
Intuition. So I feel like it's an intuitive process, like somebody's name will jump out.
Mm-hmm.
Somebody's name will jump out. It's an intuitive, like almost, I don't know, subconscious level. You know who you should talk to, or I know who I should talk to.
Yeah, I like that. I like that a lot.
So,
yeah.
Or, you know, volunteer or do something, you know, helpful in the community. I know there's a list right now for Buffalo volunteers for COVID. I don't know if they contact tracers or people to deliver things or what they're using the volunteers for, but I know there is, I think, a website set up specifically for that. So
okay,
I recommend that.
Yes. Well, this has been very informative.
Yes.
It's been a really interesting conversation. I've enjoyed it.
Me too.
Yeah.
Me too. Thanks for inviting me.
Absolutely. Thank you for agreeing to do this.
Pardon?
I said thank you for agreeing to do this with me.
Well, I hope that it helps somebody.
Me too.
Yeah.
So me too. I'm going to end the recording now.
Okay.
And so thank you to everybody who watched. And please feel free to place your comments in the YouTube comments section and let Janice and I know your thoughts on this topic.